Now, let's visualize how to make a diagnosis in diabetes. So now when you have done all these elements, you want now to put a diagnosis. After your physical examination or your clinical presentation, you want to put a diagnosis. To put a diagnosis in diabetes, you start by one, the complication. Is it clear? Generally, if it is an acute complication, you say which particular complication. Is it acute or chronic complication? You say which particular complication that you are speaking about. So generally now, if it is acute or chronic, you say the complication. Generally, you need to know that what every time you have an acute complication, is it clear, there must be a precipitating factor. So you must speak about the precipitating factor of the acute complication. Is it clear? You must speak about the precipitating factor of that acute complication. And when you speak about the precipitating factor of that acute complication, you say now in the background of which type of diabetes. Is it type 1 or is it type 2 diabetes? So that's how you make a diagnosis. Okay, let us take an example of that diagnostic making in diabetes. So if you have a patient that comes with acute complication of diabetes, which is hyperglycemia, it comes with signs of hyperglycemia, it comes with acute complication of diabetes, you're going to say it is hyperglycemic crisis. Is it clear? You say hyperglycemic crisis. Probably, is it clear, based now on the signs that you have. If you have signs of hyperglycemia, you have signs of ketosis, you have signs of acidosis on your physical, on your clinical presentation, you say DKA. Is it clear? And now, or if you have now other signs like signs of dehydration, signs of hypertension, you have signs of hyperglycemia, you put honk. Is it clear? So those are the way that you put. It can be these two hyperglycemic highs. Now, provided the patient instead present with a Glasgow of less than or equals to 8, it's no more hyperglycemic highs, but it's hyperglycemic coma. And generally, the patient that present with hyperglycemic coma are more of honk than DKA. While the patient that present with hyperglycemic crisis, just a crisis where they have altered level of consciousness confused, they are more of DKA than honk. Basically, so that's how you visualize it. Now, the next thing is now speaking about the precipitating factor. Precipitating factor. Is it clear? Now, the precipitating factor of diabetes are mostly instances of stress. Is it clear? There are two types of stress. You have according to SchrDbb, there are two types of stress. You have sympathetic stress and you have glucocorticoid stress. Is it clear? Glucocorticoid stress. Now, this sympathetic stress and glucocorticoid stress are going to apply in two different types of people. There are certain people that when they are stressed, they don't like eating food. Those are the people that have sympathetic stress. Is it clear? While there are certain people that when they are instead stressed, they like eating too much. Those are people that have glucocorticoid stress. So that's why you may see some people that may be stressing and they are gaining weight, while others when they are stressing, they are becoming more and more thin or slim. Is it clear? So those are the different types of stress. Now in sympathetic stress, you have just a surge of adrenaline. Is it clear? You have a sudden surge of adrenaline. That's why in sympathetic stress you may have an increase in glucose level, a sudden increase in glucose level, because adrenaline and noradrenaline also causes what? It causes gluconeogenesis and causes the reabsorption of glucose inside the blood cells. Similarly, glucocorticoids, is it clear? Glucocorticoids causes what? A surge of glucose, causing more glucogenesis. But now, mostly in patient that has glucocorticoid stress, there is nothing like reabsorption of the glucose in the body. So that surge is more pronounced for a long period of time in patient with glucocorticoid stress. While in a patient with a sympathetic stress, the surge of glucose is only at an instant. While a patient with glucocorticoid stress, the surge is going to be pronounced for a long period of time. So when you measure their glucose level, their glucose level is going to be high for a long period of time when you have glucocorticoid stress. Basically. Now, what are the elements that can result to this stress? We can have infections. Is it clear? Infections can result to this stress. And we have already said that when you have a diabetic patient and you have infection, you must check the respiratory system, you must check the urinary system, you must check the integumentary system, and you must check the gastrointestinal system in this order. Is it clear? So check in this order. You must check for signs of all these focus to know if infection. And if you don't see any focus, you now think of, without any focus, you now think of malaria. Is it clear? So after excluding, so malaria is anytime that you have cells plus no focus. If you have systemic or inflammatory syndrome without any focus, you now accuse malaria. Now, the next one after infection, we now speak of traumatic stress. You have traumatic stress, is it clear? So there are certain trauma that can be stressful. So now the next thing after traumatic stress, we can also have psychogenic stress. Is it clear? Psychogenic stress. Is it clear? So it's stress which is psychogenic. You can have also psychogenic stress. Now the next stress, we have iatrogenic stress. Is it clear? Iatrogenic stress type. So iatrogenic stress because the patient is just taking medication. Is it clear? Too much medication is going to be an iatrogenic stress. And then the next one now, after iatrogenic stress, you can have idiopathic causes of the precipitating factor. So a precipitating factor is there, but we have not yet found the cause of that hyperglycemia. There are other even causes of hyperglycemic crisis, which may even come from a tumoral stress. Is it clear? So tumoral stress, all this stress may be useful. So those are or even pain, just pain can cause a stress. Is it clear? Pain, like pain in trauma, can cause a stress. So all those are the different things that can involve in causing these different types of stress. So from here we continue with the next part of the tutorial.